Good afternoon, everyone. Welcome to today's update on COVID-19 in Alberta. With us, as always, is Dr. Deena Hinshaw, Chief Medical Officer of Health for the province. Dr. Hinshaw will provide a brief update, and then we will open the floor to questions.
Thank you, Tom, and good afternoon. Today, I am pleased to report 6,106 Albertans have recovered from COVID-19, leaving 679 active cases in the province. This is the fewest number of active cases in Alberta since March 30th. Of course, we must not forget that this virus is still impacting many people across the province. Currently, 43 people are hospitalized with COVID-19, with 4 of those admitted to ICUs. In the last 24 hours, out of 3,168 new test results, there were 25 new cases. Sadly, I must report that there are 2 new deaths today. I would like to extend my sympathies to all those who have lost loved ones during this time. As we gradually lift restrictions, we must not forget that this virus can lead to serious outcomes and that it will be with us for many months to come. While the most severe outcomes of this infection are seen disproportionately in those who are older or who have other medical conditions, it is important for us to be constantly learning of all the ways that COVID-19 can impact our health. In the past several weeks, cases of a new condition called multisystem inflammatory syndrome in children, or MISC, have been reported in a number of jurisdictions. It is similar to an inflammatory disease known as Kawasaki's disease and responds to treatments such as steroids. It has been seen in the UK, Italy, Quebec, and the United States. Potential cases are also being explored in other provinces across the country. Today, I am announcing that one possible case of MISC is being investigated in Alberta this week. Reported cases across the jurisdictions I mentioned involve children and adolescents with recent infection with the virus, with the syndrome seeming to develop several weeks to about a month after an infection. MISC involves inflammation of multiple organs, including the heart, kidneys, blood vessels, and nervous system. Fever is a key feature of this syndrome, and other symptoms can include rash, vomiting, diarrhea, and abdominal pain. The early information available suggests that the majority of children who have COVID-19 would not be expected to experience this syndrome. However, we are making this disease reportable in order to monitor any cases that might occur and to improve our understanding of this illness. We are developing clear guidelines aligned with global reporting standards in order to support healthcare providers in diagnosing and reporting this condition to public health authorities. I know this new condition might be scary for parents. I worry for my kids too. It is important to remember that this condition appears to be rare and it is treatable. It is, however, a reminder that we continue to learn new things about this virus and that we must continue to be cautious in our relaunch. This is also a good time to look around and remember that we are not alone in Alberta. Other provinces in Canada and the vast majority of countries around the world have taken similar measures to us, with some taking much more stringent steps. As summer approaches, we must not forget that COVID-19 was and is a deadly disease. When we look at the impact of COVID-19 on a global scale, during the peak of global deaths in April, the number of weekly deaths being reported was higher than lung cancer, road injuries, diabetes, or suicide. Even with unprecedented efforts to stop spread, the cumulative global death count so far this year for COVID-19 is higher than what would be expected for year-to-date global deaths from malaria or homicides. Closer to home, while this is often compared to influenza, our current COVID-19 death toll of 142 in Alberta is 1.5 times higher than the highest annual influenza death number in the last 5 years, and we have never taken such measures to prevent influenza from circulating. It is on all of us to look out for one another and protect our most vulnerable from harm. We are still in this fight together. Last weekend, I saw a great metaphor for this while driving with my family. We noticed a slowdown on the road ahead of us and had to stop for a moment without knowing what was happening. When we got closer, we saw two large pickup trucks driving slowly on either side of a median between an exit ramp and the main road. It wasn't apparent until driving by them that they were escorting a Canada goose and her goslings, protecting them from oncoming traffic. I love this image of Albertans protecting the most vulnerable, and the vehicles around them being patient and accommodating, giving them space to get the goslings to safety. The individuals in these two trucks did this not because it was required of them, but because it was the right thing to do. We can all emulate this behavior in our daily lives by considering what we are able to do to make it safer for those around us. It might be inconvenient and even awkward to adjust to measures like wearing masks when we are around others in public, or always staying home when we are sick. But if we remember why we are doing this, that our collective actions are to prevent severe illness and death, we are reminded why our actions matter. As I've read and listened to stories of how individuals and communities big and small across Alberta have worked together to respond to this pandemic, I am continually inspired by the ingenuity and generosity of Albertans. Thank you for your commitment and compassion. Before I conclude, I'd like to say a few words about the National Hockey League. We are currently developing guidelines that would allow Edmonton to be a hub city for the NHL playoffs. These guidelines have been developed to support players, NHL staff, media personnel, and Albertans to stay healthy and safe during such an event. We remain open to working with the NHL to address any concerns before these guidelines are finalized, whether that relates to quarantine requirements or any other matter. This will be completed in consideration of existing federal and provincial quarantine requirements that are in place for international travelers that may need to be addressed to accommodate the NHL's proposal. This could include further clarifying the concept of a group cohort for quarantine purposes that is currently in our guidelines, and how this could be incorporated into planning for practices and games. I know Premier Kenny has identified this as a matter that he wishes to resolve in the letter that he sent to the Prime Minister yesterday. Safety must be the top priority. In order to make this happen, all levels of government and the NHL will have to collaborate and find creative solutions. I have been in touch with my colleagues at the federal level to discuss this issue and how we can use cohort quarantine to ensure both public safety as well as safe practices and games for NHL teams. It's important to remember that if this event goes ahead, it would happen later in the summer. I know that many Albertans are anxious for some sporting events to begin much sooner. As I mentioned on Monday, I have heard the concerns and opinions expressed by Albertans, and we are currently exploring whether some sporting activities for all Albertans could be safely included in Stage 2. I will update Albertans when I know more. Thank you, and I'm happy to take questions.
All right, we'll go to the phone now. Operator, could you put through the first caller?
First is Kevin Nimick with CTV. Go ahead, Kevin.
Hinshaw, you spoke a little earlier about accommodations that could be made for the NHL to allow Edmonton to serve as a hub. I'm wondering about the potential of a double standard to be created between regular people and NHL players, as well as media and staff for these teams. Are you concerned that that could put Albertans at risk if NHL players are allowed, for example, to come across borders from all sorts of countries, be they in Europe or the United States? And BC Premier John Horgan said today that his province would not waive any rules for the NHL. Why does Alberta feel so differently?
So I want to be clear that with respect to the quarantine rules, the guidelines that we have put in place that we feel would adequately address safety of Albertans, as well as being considerate of the opportunity for sporting events, which we know Albertans enjoy, to take place, that we think balances both of those interests. I want to be clear that we're not talking about waiving the quarantine requirements. In Alberta, the guidelines that we've put together that would need to be followed if the event were to happen here. What we've put together is an opportunity for a cohort quarantine, which would mean that a group that came in from international travel, such as an individual team, would have to stay together in that quarantine period and would not be able to interact with others outside of that cohort group. And as I mentioned, that size of that cohort group, whether it's one team or two teams that could potentially allow play, they would be effectively sealed off from the rest of the community, and there would be no interaction between them and the rest of the community, which, with respect to public safety, is the consideration that we take most seriously. With respect to the double standard with concerning other Albertans who might be coming in from international travel or those who wish to access arenas, as I mentioned, we are looking at including sports and access to recreational facilities under public health guidelines, potentially in stage 2, which would likely be happening before, if this NHL event does come to Edmonton, that would be later in the summer. So I anticipate that Albertans will actually be able to access arenas depending on the decisions that are made, even before the NHL teams arrive, if they were to come here. And we do make exceptions under the quarantine provisions for essential service workers as long as they are allowed to follow certain criteria. So again, other Albertans who can meet very strict requirements are sometimes have an alternate version of quarantine that they work within in order to facilitate certain activities happening. So again, I don't believe that the alternate quarantine provisions put Albertans at risk at all. And I believe that the access to arenas is something that Albertans would be able to do. And if any sports team wishes to engage in competition and is able to abide by the sporting guidelines that we've put together for the NHL to consider, then the same guidelines would apply to them and the same kinds of considerations would apply to them as well.
Operator, can you put through the next question, please?
Next is Julia Wong with Global News. Go ahead, Julia.
Hi, Dr. Hinshaw. There were some disturbing findings in the military's report of long-term care homes in Ontario concerning their conditions. You mentioned earlier this month that Alberta Health has started a proactive audit inspection plan of continuing care facilities. What initial findings can you share, and what concerns, if any, have been raised regarding the conditions of continuing care homes in Alberta?
So I haven't seen the results back from the early audit, so I think that's something we'll have to get back to you on. With respect to what I do know about continuing care homes where we've had outbreaks, is that there has been, when there has been a case identified, again, as soon as there's a single COVID case in a resident or staff member, Alberta Health Services is engaging with that facility to make sure that outbreak measures are in place. And that early engagement does allow for proactive monitoring of the situation. And in some cases where there have been concerns about the ability of operators to meet all of the requirements, Alberta Health Services has taken over operations of those facilities. So again, that's the work that we're doing with those facilities that have outbreaks. And I will work with Tom to get back to you about the proactive audit results that have been completed to date.
Operator, can you put through the next question, please?
Next is Michelle Belfontaine with CBC. Go ahead, Michelle.
Oh, hi there, Dr. Hinshaw. Thanks for taking my call. Today in the legislature, Premier Kenney indicated that Alberta will not renew the state of public health emergency on June 15th. So what does that mean, and how would that affect people's lives here in Alberta?
So I haven't had the opportunity to have that conversation. So I think that might be a question best addressed to the Premier in terms of that particular information.
Operator, can you put through the next question, please?
Next is Michael King with Global News. Go ahead, Michael.
Hi there, Dr. Hinshaw. We're hearing that some popular vacation towns in BC are ready for Albertans, but the Relaunch strategy doesn't lift the recommendations against travel between provinces until, I think, stage 3. Can we expect that to change, and what would your recommendations be for people who have second homes outside of Alberta?
So we are in discussions with other provinces with respect to interprovincial travel, but a conclusion or a timeline has not yet been reached. So my current recommendation with respect to this coming weekend or the near future would continue to be that we would recommend against interprovincial travel at this time. But do recognize that Albertans may have vacation homes or family in other provinces and be wondering if they might be able to travel this summer. So that is something that we are talking to other provinces about, and hopefully we'll have some additional information. But again, some of the recommendations will depend on how many cases we have in Alberta, how many cases other provinces are seeing. And so while we continue to have those conversations, it will be impacted by our ongoing success in keeping our numbers down throughout our relaunch process.
Operator, can you put through the next question, please?
Next is Rick Bell with the Calgary Sun. Go ahead, Rick.
Good afternoon, Doctor. Just a quick question. Has there been any discussion, I just want to be clear, has there been any discussion, and is there any chance for phase 2, which the Premier talked about being at June 19th at the earliest, being moved up as a date? And where are we at with regards to gym/fitness facilities and perhaps moving them ahead from phase 3? So where are we at with both of those issues?
So our encouraging numbers through the first few weeks of stage 1 of relaunch have given us the confidence that we can talk about potentially accelerating that date. So a final decision has not yet been made, but given how well Albertans have been doing keeping our numbers down as we move through opening up different aspects of our society, that consideration of an earlier date is certainly on the table while a final decision has not yet been made. With respect to fitness facilities, we are looking at fitness, sports, and recreation, some aspects of those 3 types of activities that could potentially be moved from stage 3 into stage 2. And that conversation, again, a final decision has not yet been made, but we will be bringing a proposal forward to the Emergency Management Cabinet Committee next week for consideration of how we can safely move those activities that have a lower risk of transmission into an earlier stage of our relaunch.
Operator, can you put through the next question, please?
Next is Ryan Rishaw with TSN. Go ahead, Ryan.
Hi, Dr. Hinshaw. I know that there are a million what-ifs with a scenario like this, and you can't necessarily contemplate every one, but I think a fundamental what-if with the NHL potentially coming to Edmonton as a hub city is what if a player tests positive once competition has already begun? And what do you envision the protocol being that would allow competition to continue if an athlete who is in and around his teammates and his other cohorts were to test positive? The NHL has stated repeatedly they believe that one or more positive tests wouldn't necessarily mean that the competition has to shut down. So what would protocol look like in that event?
So in the event of a positive test, then we would investigate, as we do any positive COVID case. We would determine who the close contacts were, and we would determine what the time period was of the person who tested positive, what the time period was that they were potentially infective to others, who they were in close contact with at that time, and then make a determination about the quarantine requirements for those close contacts. I think that we would have to look very closely at the concept. We're talking about the cohort quarantine concept for the international travel, incoming travelers, and so that potentially could be a consideration, but that's not something that we've discussed in detail. And ultimately, I would say that whoever is a close contact would have to be in quarantine. What that quarantine looks like, we could discuss.
Just a point of clarification, there are 141 deaths from COVID-19 at this time in Alberta. Operator, could you put through the next question, please?
Next is Jason Herring with the Calgary Herald. Go ahead, Jason.
Hi, Dr. Hinshaw. Thank you for taking my question. It's another NHL one. Given that it's been said that a high level of testing would be necessary to facilitate NHL play and ensure that players aren't asymptomatic carriers of the virus, I'm wondering if there's a plan for testing for players, and then if so, what are the ethical considerations if we're prioritizing testing for NHL players, especially with hindsight from the controversy that emerged when the Calgary Flames players jumped the queue on the H1N1 vaccines in 2009?
So we've been working with private labs in Alberta to put together a policy to allow companies that wish to do additional testing over and above what would be recommended under kind of our typical public health approach, so that there could be private pay options. And so the agreements that we're working on would facilitate access for those employers or companies that, again, would want to access testing for the purposes of a particular employer, making sure that that fell within public health guidelines of a requirement to report any positive cases, validation of the methodology that's being used, and making sure that we are really clear on the follow-up. So that is the framework that's being used for the NHL, that, again, the expectation being that if there were to be any shortages of lab supplies in the province, that we would be including that as a part of the framework, that lab supplies would be prioritized for public testing, and that if there was sufficient testing supplies, then they could be purchased through a private lab for those employers, such as the NHL, that wish to do so.
Operator, can you put through the next question, please?
Next is Carrie Tate with the Globe and Mail. Go ahead, Carrie.
Hi, thanks for taking my call. Dr. Hinshaw, can you tell us a little bit more about the child or adolescent with the Kawasaki-like disease, an age, whether this person was admitted to an ICU, if it he or she tested positive for an active COVID case?
We can't give any identifying information about the individual case. I can let you know that they're in stable condition as far as I understand, and being treated in hospital, but I'm not able to give age other than saying that it was a child, and that it's currently under, the case is currently under investigation with respect to the criteria for this, because we are just in the process of making this reportable. So we're just working on confirming some of those details.
Excellent. We've got time for 3 more questions. Operator, could you put through the next one, please?
Next is Jennifer Lee with CBC News. Go ahead, Jennifer.
Hi, Dr. Hinshaw. My question is also about this possible case of multisystem inflammatory condition that you're investigating. I guess I'm wondering, now that this has come to your attention, what steps are being taken to sort out how many more cases could potentially be in the community? And further to that, I guess, what's being done in terms of the healthcare system to prepare it for to prepare hospitals, doctors for these cases now that you're looking, now that you're investigating potentially the first case?
Sure. So with respect to preparing the system, part of the work that we're doing is to make sure that physicians who might be seeing these patients, so there's different groups who might see them, such as pediatricians, family physicians, rheumatologists, infectious disease specialists, that they are aware of the reporting requirement, they're aware of the case definition that we're using, and I believe that most clinicians would be aware of this syndrome. It's been getting quite a bit of media attention, but we want to make sure we're officially reaching out to them to let them know how we're defining it based on international criteria, and that it is now going to be a reportable disease. With respect to the treatment, so the syndrome is very similar to a syndrome called Kawasaki disease, which is something that has been around for many years. So I think that most clinicians who would see a patient who has this kind of presentation with a fever, rash, sometimes abdominal pain or other symptoms, the treatment for this disease is essentially the same anti-inflammatory treatment, including steroids as an example. And so I think what we're doing is less preparing the system for something entirely new, and more making sure that people are aware that this very similar syndrome seems to be related to a recent history of COVID infection, and the need to consider COVID and COVID exposure history as a part of the differential. And so that's more what we're doing, and I anticipate that our system is well prepared to handle this. What we've seen in other jurisdictions is that it is a relatively small proportion of children infected with COVID who go on to develop this syndrome, but we want to make sure that we're learning as much as we can so that we can inform parents and clinicians about some of the ramifications of this particular infection and how it relates to this emerging syndrome that we're seeing.
Operator, could you put through our second last question, please?
We have Sarolta Sasqui with City News. Go ahead, Sarolta.
Hi, Dr. Hinshaw. There's been a massive group of parents that have formed kind of across Alberta trying to get arenas reopened in stage 2. Now, what they're petitioning for is to give kind of young hockey players not even just like the chance to play games, but just the chance to practice in small groups, just to kind of get the kids out on the ice. Is that kind of a reality for stage 2? Are we going to see that in stage 2?
So we are looking as a part of the proposal that we'll be bringing forward at opening recreation facilities such as arenas, rec centers, fitness facilities for certain activities that can still follow the public health guidance of making sure that there's distancing, making sure that any common equipment is sanitized, that kind of thing. And so arenas are on that list for consideration. But again, a final decision has not been made. And so that's something that we'll be bringing forward next week for discussion. So more information can be expected on that next week.
Operator, can you put through the final caller, please?
Final question is Dylan Short with the Edmonton Journal. Go ahead, Dylan.
Hey, Dr. Hinshaw. My question is about the MIS-C as well. If a parent suspects their child has MIS-C, what should they do? Do they have to call 811 first, or can they head into hospital? Just sort of if they're worried, what should they do?
So if a parent suspects that their child does have this syndrome, the part of this syndrome is a high fever for 3 days. The child is relatively unwell. Again, they can have a rash. And feel unwell. And to be clear, if a child has a high fever, you don't need to wait for 3 days before getting medical attention. So the parent can absolutely take them in. If they need medical care, they can call their family doctor, call 811 if they would like to get some additional advice at home, or take them into the emergency department if they feel that their child is very ill. And so any of those are completely appropriate, and it would depend on the situation and the parents' knowledge of their child and how ill that child is, how concerned they are, whether or not they would go through their family doctor first or 811 or go directly to the emergency department. Most children that have been reported with this particular syndrome, it does seem like it is something that happens after a COVID infection. For those that have been reported to be related to COVID, so several weeks to about a month. So typically what we are seeing, although again, this is still very new, so more information is emerging, typically a child who has this particular syndrome would not be considered, again, for what we know right now, to be infectious or infected with COVID at that point. It seems to be more something that happens as a result of their immune system going into overdrive after an infection and causing this inflammatory response in multiple organs.
Thank you all for joining us. We will provide another update on Friday afternoon.